Welcome back, everyone. It's Colon Cancer Awareness Month. I'm now joined live on the phone by Dr. Clayton Spiceland, who is a gastroenterologist with TriStar Southern Hills Medical Center. So, Dr. Spiceland, good morning. We appreciate you being here with us today to talk about this very important topic. Let's start with talking about the risk factors that people need to know about for colon cancer.
Great. Yeah, thanks for having me. First of all, this is March's Colon Cancer Awareness Month, and I appreciate you making time to talk about this topic. And yeah, starting with risk factors. And so there are definitely things that people can do that do increase the risk for colon cancer. Some of those things are, smoking or some of the things that we can consume in our diets. But the real risk factors can be genetic, and that means that we may not know about those risk factors. And so, sometimes it's family members that have had colon cancer increases our risk, but some of those genetic risk factors we're not even aware of, and that's why screening is such an important thing to talk about.
Wow. So let's talk about that screening, Dr. Spiceland, because do you think there is sometimes, some hesitancy about people, getting a colonoscopy? Talk about the importance of getting that screening. What age should you start getting screenings and so on?
Definitely. And so, yes, the guidelines for colon cancer screening recently changed. And so the age that we start screening people now is at age 45. It used to be 50. Now it's 45. And the reason that change was made is because, we were noticing that precancerous polyps were developing in people that were younger than 50. And so, yeah, you mentioned the hesitancy of getting screened and getting a colonoscopy. And yes, that is definitely a real thing. And unfortunately, it does keep some people from getting screened or getting screened at the right age. And so I wanted to speak to that because nobody's excited to come and get a colonoscopy. Okay, we all hear about stories that make people not want to get excited to do that. But I wanted to talk about that the process of going through a colonoscopy is much easier than it used to be. So first of all, a patient is sedated for the procedure, so there's no discomfort or pain. And the preparation that used to be such a tough thing to go through are much easier now. The colon preps, which clean out the bowel, are much smaller volume, and they're just much easier to tolerate. So some of those hesitancies are definitely still there, but I just want people to know that the process is much easier than it used to be.
Wow, well, that's definitely good to know and good information to share with our viewers. But I also wanted to ask you, for people who have waited too long to go get that screening, what are some of the symptoms, that indicate, really this is time to really check in with your medical doctor?
Definitely, yeah, and that's so important to think about because it's not just a patient of a certain age that needs a colonoscopy. Anybody that is experiencing a change in their bowel habits or blood in their stool or a change in the size of their stool, those could be warning signs that something's going on in the colon, and that should prompt you to give your doctor a call, and they can send you to the right spot to get the next step.
Okay. Why do you think it's so important for you, doctor, to come on and to share this information about Colon Cancer Awareness Month? Why do you think it's so vital to really get this message out to the community?
So a couple reasons. One is colon cancer is one of the few cancers that can be preventable by screening. And so these colonoscopies, procedures that we do, are not just screening tests. They can be preventative tests because we are looking for small growths in the colon called polyps that can be completely removed. And those polyps are things that could have grown into a cancer. And so if we can take those off when they're small, we can prevent a cancer down the line. And I just want to make sure that people are aware of that. It's not just going in and looking for something. We're actually can change the natural history of something by preventing things. And then the second thing is I just want to reiterate that the ease of getting screened now. Colonoscopy is the gold standard, but there are patients who are at average risk that can do a stool-based test that is easier than a colonoscopy, and if negative, they may not need a colonoscopy at that time. So even for the folks out there that are not going to get a colonoscopy for whatever reason, there are still screening options, and it's something they should talk to their doctor about.
Okay. Dr. Spiceland, thank you so much for your time this morning. We appreciate it. We're going to have all this information on our website, folks. Just go to WKRN.com.